we had hand washing compliance of 34%. Nobody seemed really fussed about it. We were improving. We had a plan. We had a committee. We had all those things. We're going to get better. What was our target? Like 50%. So I said, you know, that means we're knowingly, when there's so much evidence about hand washing, to me, if it's a 5 out of 10, 5 out of 10 people are knowingly harming people. It's a choice. And I decided to look at hand washing as a vital behavior, because we also had challenges in our hospital where the place wasn't clean. People were dropping things. People were walking around like this. It was it felt oppressed. And when you've got an oppressed environment, people just they don't take the pride, they don't walk with the confidence. And there was an element almost that I knew they cared, but they didn't behave like they cared in terms of taking care of each other and the things that we knew were important. And so I talked about hand washing, indisputable evidence. We actually had a policy that said you were to wash your hands. And never in my wildest dreams as a hospital CEO did I think, yes, I've made it. I'm going to talk to people about washing your damn hands. But this was what we decided, and with this vital behavior of saying, this is our moment of saying enough. This actually isn't a choice. It's not a policy so that you can just read it and discard it or not choose to read it. This is something that we know, we have evidence, that this is a practice that we must uphold. And I framed it as saying every time we don't wash our hands in the way that we know that we need to, we are knowingly inducing harm. And we made a commitment to people and our communities, our patients, and ourselves that we were going to eliminate all preventable harm. Well, we may take a while to get to the all preventable harm, but the one thing we're going to focus on more than anything else is washing our hands as the contribution to eliminating hospital-acquired infections, in particular so that our patients and families, our patients will not die of a hospital-acquired infection. So I went back, and I actually also did something I'd never done in my career in looking out at people, and I actually said, I don't care if you're the chief of surgery, I don't care if you are the most loved nurse. If you choose not to wash your hands and knowingly harm patients, and you choose not to follow the policy, I will gladly accept your resignation. And that moment became the catalyst for action on a whole variety of levels. We went to the Patient and Family Advisory Council, and I said, what else? What are some of your ideas of how else we can move? What else can we do? And they said, you know what? Every time people walk into a unit, and every time people walk into our hospital, they should know how often people are washing their hands. So I'm not a big campaign poster person. I really am all about the proof, not the promotion. And yet, this is the one time I allowed a poster to go up in our organization. And it was one that the patients and families had designed. And then it had a very simple image, and then where you can rub out and put the percentage of hand washing compliance everywhere in the hospital, particularly when you walk onto the unit for that particular unit. What happened? People started washing their hands. And the interesting thing is, our hand hygiene compliance, it rose from that 34% and held at the 95 to 98%. And that Kingston General Hospital, the teams are amazing. They've held that for at least 3 years. So it's a sustained change. It wasn't a campaign. It was a sustained change that was focused on the behavior and focused on involving and engaging patients in reminding people of the importance. When staff come for orientation at KGH, who teaches hand hygiene when the staff arrive? A patient.